this event with UN Special Coordinator for Lebanon, Dr. Najat Rochdi. I do wish these were better times for Beirut and for our conversation. Just this week, a World Bank report classified Lebanon's crisis as one of the worst the world may have seen in more than 150 years. Half the country is under the poverty line. The Lebanese lira has lost around 85% of its value since the beginning of the crisis. For any of you who speak to people in Beirut, you would know and hear about food, fuel, and medicine shortages. The political elite see this with corruption, has still not formed a government or pursued accountability in the port explosion. Our conversation with Dr. Rochdi will focus on what the UN is doing to mitigate the collapse and if the humanitarian aid is getting to the right people. In the hour that we have, I would like to keep this as conversational as possible. So at any point you have a question, please shoot it on Zoom. You can also use hashtag MEI Lebanon to ask questions or engage in the conversation on Twitter. And I do hope in the hour that we have that we cover as many topics as we can, because this is a unique guest that we don't hear from enough in Washington, DC. With that, I will turn it to Dr. Rochdi, who has some opening remarks, and then we will go ahead with the questions. Thank you very much.
Thank you very much, Joyce. Good morning, good afternoon, good evening to all of you joining today. And I really would like to sincerely thank Middle East Institute for this opportunity actually to reflect on the situation in Lebanon. I am afraid, though, it will be a sobering session with much ground to cover. So hopefully we will be able to still address all your questions. Let me start with one thing. I think we all immediately jump to figures, statistics. I would like to give a human face to the tragedy Lebanon is going through. Yesterday, I was introduced virtually to 5 touching human stories, which are really underlining the worsening situation in Lebanon. A 59-year-old homeless called Yusuf. Remember, Yusuf, it's not 55%. It's not 10%. His name is Yusuf, whose dream is to have a door that he can close when he sleeps and a roof above his head. Shadi, a 15-year-old young man, has another simple dream: to have a mobile phone, a car, and some decent clothes. And he told me I should be in school. And it's true, he should be in school, studying, taking money from my parents. I'm not the other way around. And yet, he is the one working because he still has to bring money to the house. Nadine, a 41-year-old disabled housewife, she is struggling to put food on the table. And she told us, it scares me to be unable to provide food for my kids anymore. I'm talking about Lebanese people who just a year ago never had to go through this kind of issues. Have you felt that any of those dreams are exceptional, are luxurious? Every single dream I'm referring to is just a basic right that every single Lebanese citizen should be able to enjoy and has been able to enjoy until, last year. So those are really very simple and sobering stories. But please remember that. Remember Yusuf, Shadi, Nadine, and many others, whenever you think about Lebanon. And it's unfortunately and tragically and sadly a grim reflection of the current situation in the country. And as you all know by now, the country is grappling with an economic and financial meltdown. The disastrous impact of the Beirut port explosions, it's almost a year ago now. the spillover effects of the ongoing Syrian crisis, and worse than that, a political deadlock that is fueling popular protest and blocking any possibility of meaningful reform and recovery. So the situation of ordinary people like Yusuf, Shadi, and Nadine is worsening by the day, and Lebanon's stability is shaken to the core. And if Lebanon's stability is shaken, trust me, the neighbors will feel it. Lebanon was not long time ago considered as a high middle income country, and now is facing one of its worst financial and economic crises in its modern history. And by the way, they cannot blame anyone from outside for being the cause of that. That is really Lebanese made by Lebanese decision makers, or actually by the lack of the right decision making. The country is in the middle of a phase of hyperinflation, eroding the value of the national currency, people's purchasing power, and what remains of their trust in their leaders and institutions. The trust deficit has never been that bad. Between April 2019 and April 2021, the consumer price index has increased by more than 200%. And the price of food and beverage increased by 670% in a very short time. Shops no longer wishing to exchange their stocks for devalued currency are shutting their doors. And unemployment is increasing dramatically. By any standards, these trends are moving at a speed that is no less than stunning. And for most families, the results are crippling. As you said already, Joyce, more than half of the Lebanese people are now living in poverty, and a quarter of the population is living in extreme poverty for the first time ever in the history of Lebanon. The crisis in the economy and in the currency has meant a breakdown of public services, education, health, food, water, electricity, at a time when they are most needed. The public health system is stretched beyond its limit from the double impact of the economic crisis and the COVID-19 outbreak. People are increasingly unable to access and afford healthcare amid the growing shortages of important medicines and medical supplies. The loss of salary values has meant that skilled healthcare workers have migrated elsewhere, unfortunately. One indicator, 800 doctors left Lebanon in less than a year. While COVID-19 cases are declining in Lebanon, the vaccination program is still slow, especially in areas outside of the capital. Worse than that, mental health is really very worrisome, with an increase of 52% in calls to the Embrace, the Suicide Watch hotline. Education in Lebanon has been equally hard hit, and according to UNICEF, at least 1.2 million children, 1.2 million children, including Lebanese, Syrian, and Palestinian, have had their education disrupted. As with health workers, the devaluation of the Lebanese pound has significantly affected teachers' salaries. And the reason why I mentioned those is, Lebanon was known for human capital. It still has a great human capital, but that was because of a great quality education system. It was known for the excellent medical and health system. And today it's completely, it has broke down. It was known for its tourism. It was known for the wonderful life. And we have 52% increase in the calls for the Suicide Watch. All of that, and Lebanon, which used to export food to other countries, today is in the middle of a food crisis and malnutrition. So all of that led to some very specific humanitarian needs. Over to you, Joyce.
Well, thank you for this very dire picture, no matter how we look at it, whether the stories of Yusuf or Shadi or Nadine that you described, it's tragic. And my question to you, overseeing the UN humanitarian aid in Lebanon, what areas are you focusing on? How are you coordinating, this operation with international donors? And what are you anticipating in the months to come?
Yeah, well, unfortunately, I don't really have good news for you. And I think if I had, everybody would have been surprised. Right after the explosion, the following day, actually, because Lebanon has never been a humanitarian crisis country. And therefore, we had very quickly after the explosion to put all the mechanism, and the tools and the coordination structure for us to be able to come up with an emergency response. So we have been able to immediately deploy, what we call the sectors, which actually brought together the NGOs, international and national, the UN agencies, the donors, the partners, in coordination, of course, with the government, and in that case, with the army as well, because, the state of emergency has been declared since then and is still ongoing. So we have been put that in place, which actually was very useful for us now to also try to cover the emerging needs, humanitarian needs. Most of the humanitarian crises in the world, they have two reasons. They have two root causes. The first one is about a conflict, so it's right after a conflict. And the second one is about natural disaster. The humanitarian needs in Lebanon are not because of that. I'm not talking about the explosion. The explosion, anyway, it was really localized in around 3 kilometers in the radius of the explosion. I'm talking about the needs now that are spreading through the whole of the country. Those are unfortunately the normal consequences of either bad decisions or no decisions. This is because of the bad governance. This is because of the lack of reforms. This is because of the dysfunctioning of the institution and all of that. But that said, it does not mean that we should not address actually the needs of the most vulnerable. And we have identified 4 very important areas of support. The first one is food security. And as I told you, this is the first time ever Lebanon is a food insecure country, where we have 1,234,000 people who are in need of relief assistance for food security and basic needs. Our preferred mechanism is to do it through cash assistance, because then people first of all, you preserve their dignity, and second, they still have the freedom to eat whatever they want. But we have a big gap in covering all those needs, because that was not at all in our planning in the beginning. The second priority is really about health, and health in its 2 components, the COVID-19, because we are still in a COVID-19 crisis. Even though the cases are really decreasing, it does not mean that we are out of it. And as long as the vaccination is not really covering at least 60% of the population, we still have to support, especially in light of a crisis of medicine. Because of the lack of dollars and of foreign currency, the country does not have anymore the capacity to import, first of all, drugs and medicine and equipment, and second, because of the lifting of the subsidies. So imagine the combination of all of that. And for health, it's about 1.5 million Lebanese who are in need of humanitarian health assistance. And we add to that the 400,000 migrant and domestic workers, which is a new caseload, unfortunately, and obviously the 1 million refugees. The third sector is about nutrition. When there is a food security crisis, you immediately have a nutrition crisis, where actually we have an estimation of 400,000 children and more than 300,000 lactating women who are in a humanitarian need when it comes to nutrition. We are also working on an emergency education plan because more than 1.3 million children have dropped from school. And the last time they have been at school was in October 2019, and they don't have access to a tablet. They don't have the means and the resources to pay for internet. They don't even have electricity. So obviously online learning is not an option for them. So what we are doing now, we are finalizing an MSNA. It's a multi-sector needs assessment, which is complementing actually what is done for the Syrian and the Palestine refugees with those new needs for the Lebanese and for the migrants, for us to come up with an emergency response plan, which is going to coexist with the crisis, with the Syria crisis plan for the refugees and with what UNRWA is doing. But this one will cover and address specifically the needs for the Lebanese, the new needs for the Lebanese, and obviously the new needs for the migrants. And you know, all of that is so heartbreaking because it would have been so easy to avoid it, so easy to prevent it. Over to you, Joyce.
So based on your remarks, I would want to ask you, is any of this money, is any of these programs you're doing going through the Lebanese government? And if the answer is yes, given how corrupt you've aptly described the political elite, how do you ensure that this aid is not being smuggled or going to the wrong hands?
Okay, we have two kinds of channels. You know, we have the direct assistance, and in that case, the assistance is going directly to the beneficiaries, and that's something we did, for example, after the explosion, everything was going directly to the beneficiaries. But for large scale, for example, support to the education, support to the Ministry of Health, and you know, like the emergency social safety net, you still need to do it through the institution. You have no choice. For example, the education for the Syrian refugees and for the host communities, Lebanese, who are, you know, with the Syrian refugees, we have a program and funding that is channeled through the Ministry of Education. That said, because, of course, of the awareness of a clear dysfunctioning and in many cases of clear corruption, we have actually really improved big time, really big time, the accountability and the transparency, and where we are asking really and monitoring very closely the use of those funds. You know, for example, myself as a resident and humanitarian coordinator, I'm having a meeting with either the agencies or the ministers themselves on quarterly basis, just to tell them, okay, where do we stand? So they feel that there is a much more and closer monitoring. Moreover than that, unfortunately, we came up, I mean, and that is really something I introduced, is that we don't transfer, you know, all the money that we are getting from the donors, but it's done in trenches, you know. So once we get the report for the first quarter, then we transfer, you know, the second tranche, which is a way to still keep control on the use of the funding. So we have really we have a kind of hybrid system, direct assistance, but also assistance that is going through the ministries for also a simple reason, Joyce. I mean, we cannot replace and substitute the institution. I mean, that's not the aim. The aim ultimately is to get out of the humanitarian needs, because the humanitarian assistance can never be the answer. I mean, this is just a way, you know, someone is bleeding, so you put a blast on it, but in the same time, you try to find a treatment that is going really to stop the bleeding. Otherwise, we will keep, you know, just changing the blast. That's not what we want. Therefore, it is still very important to work through the institution, ministries, municipalities, parliaments, and others. Over.
Yeah, but I mean, these are the same institutions that brought Lebanon to the place that it is today. And I don't envy the position you are in, but it's good to know there are transparency measures in place. I want to ask you about, you know, the international donors or your coordination with whether, you know, Washington or Paris or Gulf countries. Almost everyone I speak to in Lebanon, they're waiting for the implosion to happen. Are there contingency plans in place if
yes,
we get to a complete collapse? Yeah.
Yeah, we started preparing for contingency planning in January, and unfortunately, some of the scenarios we have put in the contingency planning is becoming a reality. For example, the first scenario we came up with in January was the breakdown of basic services. And we are already in this situation. You know, many Lebanese and almost all the extremely poor, which is more than 1 million Lebanese, they cannot access, I mean, very few are accessing health services. You know that most of the health system in Lebanon is private. And I can tell you, you go to a private hospital, they will ask you to put a deposit of 6 million lira, which is something like, you know, around $500. Trust me, those people, they don't have $500 as a deposit. So most of the time, they just don't get treated, which obviously is a vicious circle. So that is a scenario we had in the contingency planning, where actually we already planned to reinforce more than 250 health centers, you know, what we call PHCs, across the country, with support from the NGOs, national and international NGOs. And I have, just between brackets, I have really to praise and commend the work of the national NGOs. You know, in the middle of this tragedy, Lebanon is really lucky to have wonderful and talented Lebanese NGOs who are really committed and who are really working very, very, very hard to help, you know, the population and the poorest. So that was the first scenario. And food security, we started also coming up, you know, with some scenario, and unfortunately it's even worse than that one we planned actually in January. And by that time we extended our target from 50,000 to 150,000 in less than 4 months. It's 5 months now. We have to expand it to 800,000. So you see the gap. I mean, in every single scenario we have a gap. And to be very frank with you, in January, we still had a hope that there will be a new government appointed. And for us, it was obvious. It's a no-brainer. If there is a new government appointed, it means that the reforms will start, the discussion with IMF will resume, and therefore there would be, you know, some actions. Unfortunately, more they wait, more the situation will deteriorate very dramatically. The second scenario is a total security breakdown. I mean, let's put it that way, with social unrest, with all of that. It is starting, you know, yesterday started a global general strike, for example. We have started seeing some serious security incidents, you know, happening in here and there, especially in the north. And that is still a very likely scenario. You know, when people won't have anything to eat, and if we are not really mobilizing the funding, and I'm really making an appeal to all of those who are attending today and have the capacity to influence the capitals and the donors, please support us in providing those basic assistance, because that will also contribute, you know, to kind of security and safety of the most vulnerable, and the protection of the most vulnerable, whether they are Syrian, Palestinian, or Lebanese and migrant workers. So that was the second scenario, and unfortunately it is already starting. And the third scenario was a conflict, you know, I mean, when you are in Lebanon and knowing the dynamic, you know, in the south, you can never completely exclude, you know, this option. And actually, it's the less likely scenario. I mean, based on our interaction with both parties, this is definitely the less likely scenario. And it was very clear, you know, when the situation happened in Gaza, you know, lately. So yes, we are working on contingency planning, but at the end of the day, that's our contingency planning as United System, and we are obviously sharing that with the donor community and with the diplomatic community, whether Gulf countries or Western or others, But those who needs to have the contingency planning are the authorities, because this is their responsibility to protect the population and to deliver basic services. Over to you.
And I think your focus on the security situation is extremely alarming and interesting at the same time. If you can talk more about that, are you anticipating if the conflict, if the deadlock continues, that we would see, risks to the social cohesion in Lebanon, instability, and internal conflict in the country?
Well, I will start by saying that we don't foresee another civil war. I mean, just to be very clear, it does not mean that there is no risk actually for intercommunal and interconfessional tensions, which unfortunately we have already seen. But I can tell you, there is a combination of a number of facts that actually makes it very likely. First of all, a huge trust deficit. When you are a citizen and if ever we can say that in Lebanon they are citizens, because and please don't get me wrong, most of the time the reference of a Lebanese is not through its citizenship, but it's more through its confession, its community, its sect, its zaim, and all of that. And I think the fragility or the absence of a social contract is really one of the root causes actually of this of what is going on in Lebanon. And as long as the Lebanese don't agree, with the support of course of the international community, on what is it to be a Lebanese citizen, and how actually they can really come up with the clear loyalty to their country first, and not a loyalty to other layers, I am afraid, there will always be some risks of destabilization. So there is this trust deficit. There is what I call, this very fragile or very weak social contract, where there is not a clear understanding from the institution, from the government, that this is the list of their obligations vis-a-vis the citizen, and it's not always very clear from the citizen point of view what are their rights and what are the obligations as well. The third point for me is the conflict loyalty. I call it or the loyalty conflict. Where it's so easy just to instrumentalize, some very specific communities or some very specific groups. And we have seen that, unfortunately, this year, with the Tripoli events. We all know that all of that was instrumentalized, and a lot of it was the politicization of a very specific issue and mobilizing actually very specific groups and very specific communities, taking them to the streets, blocking roads, just out of this instrumentalization. The fourth indicator and the fourth issue is poverty. When you are a father or son or a mother or a daughter, and you have nothing, you don't have an income, and you have no opportunity whatsoever, but you have also no perspective for tomorrow. There is nobody more dangerous than someone who has nothing to lose. And we have started seeing unfortunately, some kind of extremism between brackets, and definitely some very violent narrative and hate speech growing, and I could really see it and see, if you go to the social media and you monitor the social media, this is really striking, this violent narrative and this hate speech really growing, which actually can very easily trigger, immediately some tensions and some violence. So yes, I am afraid, that if nothing is done, that we will see much more radicalization, at different levels and at different confessions and at different communities. We will see definitely an increase in the tensions between the communities, but also, which is very worrisome for us, violence against actually the Syrian refugees, and scapegoating of the refugees, while we all know that they are not the reason of the problem. I mean, but obviously, you know, when you are desperate, you always try to find someone to scapegoat. And if there is really not very quickly a revival of the state, you know, the meaning of the state, and if the gaps are not you know, filled very quickly, this vacuum, you know, nature hates vacuum. This vacuum will be filled by, you know, radical forces, and forces that will instrumentalize the public opinion, or at least the opinion of their own communities. So yes, I'm very much concerned and very much worried. Over.
So I have two questions from the audience that are actually relevant to what you're talking about. Basically, how do you go around in pushing to end the deadlock on the one hand, you know, for the government, and on the other hand, the same government is growing more dependent on international aid. So how do you balance these two? The question is from Rosabelle of the Daily Star, Rosabelle Green. And then when you talk about also, you know, several actors inside Lebanon, to what extent do you see Hezbollah and Iran responsible for the economic collapse?
Well, I will start about the second question. I mean, Lebanese are responsible for the economic collapse. Let's put it clearly, and I don't think we can put the blame on one party, you know, compared to others, frankly, because when you think about what were the political, and it's not defending anyone, but when you see the political forces that were governing the countries, at least let's say just the 10 last years or the 20 last years, I'm sorry, all of them were there, and all of them made the decision. All of them decided that the Lebanese lira will remain at 1,500, for example, exchange rate. So we cannot move from overnight from 1,500 to 12,000. I mean, obviously, there were some decision there. You know, the economic model, also the fact that it collapsed that way, that's an accumulation of a number of decisions. The absence of social protection, for example, this is not from yesterday or from 2019, this is from before. So I think one has also to be clear in its analysis. Mm-hmm. How do we balance? You know, my role as United Nations is not to balance, actually. My role as United Nations is really threefold. First, protect the most vulnerable and make sure that actually we are mobilizing, but also raising the awareness of the international community about the needs, whether it's humanitarian or recovery or development. Identify those in needs, you know, regardless of their status. So it's not, at my level, it's not about refugee, migrant, Lebanese. It's really about all the most vulnerable. And it's really important to put figures and numbers and to tell them, well, this is the scope and this is how bad it is. And it's important to really, because, you know, we have the duty to protect. And that's the commitment of the international community, right? It's really the duty to protect. So it's also to inform them on that, and therefore really to conduct this assessment in an impartial way and a neutral way, an independent way, and submit that to the donors. But obviously also to flag that and ring the bell with the politician and with the government, because at the end of the day, it is their responsibility. So I do that, and I can assure you, when I meet with political leaders or ministers or parliamentarians, I'm always very clear with them. I tell them, we are not here to substitute your duty and your work and your job. Nevertheless, because there is this vacuum and because you are not providing those services, it is important that actually there is this emergency assistance, but in the meantime, you have to prepare a more sustainable solution. And I'm very frank about this, and I'm very direct about that with all the political leaders and all, you know, those who have the decision making today. We also alert them, or at least it's a kind of early warning. I think our role as United Nations is also as an early warning when it comes to very specific, you know, security threats, because we are in the field, you know, I mean, we are very close to the communities and to the population. We are able also to have some early warning, you know, signals that we share with that we share with the authorities, but that I share also with the donors. My role also as the resident and humanitarian coordinator is to coordinate with the international community, but also to come up with the right unified position to pressure also for the decision. And for example, our motto since the explosion, but more importantly since January, is to tell them, you know what, you need to form a government. This is your responsibility. We cannot form the government. This is not our job. We don't form a government. And we don't decide who should be in this government, for God's sake. That's your responsibility. We are telling you the country is doing very badly. The people are getting very poor. The people are getting despair, hopeless.
And how do they respond to that when you tell them? Because it doesn't seem they seem to care either.
Well, unfortunately, I have to say that sometimes I feel I'm knocking my head against the wall, but it does not mean that we should give up. Some are more responsive than others. But the other thing, which is for me, is really an issue of principle. They have also to be put before their responsibilities. I'm sorry, they cannot, and that's why I started immediately by responding to Iran issue. I mean, we should. It's not about Iran. It's not about Syria. It's not about Israel. It's not about the elections in US. It's not about the election in I don't know where. No, all of that maybe is impacting. It's about, for God's sake, sit together around the same table and put at the center the people who are paying the heavy price without being the cause of anything that is going on in the country. It's about having a responsible attitude as a politician and putting the interest of the country and of the people first. Over.
You mentioned the issue of refugees and outside communities in Lebanon trying to cope with the crisis, and you mentioned scapegoating, which has been, a long story in Lebanon since the 70s, prior to the war. It's also interesting when you hear the scapegoating language coming from people in power, threatening to use those refugees as leverage to get aid from the West or other donors. So I do want you to just frankly tell the Lebanese who are watching or others why it's not the refugees who are causing this problem. And if you can, talk a little bit of your specific efforts in, supporting those communities as well as migrant domestic workers in Lebanon.
Why it's not the refugees? It's not the Syrian refugees who led to the collapse of the banking system, as far as I know.
Yes,
and I will be no, because I'm getting this question, I think, every single time I meet with some of the politicians, because this is really becoming their motto. If the refugees are going back, khalas, the country will go back to the Switzerland of the Middle East. I think the country is really far from that, really far from that. It's normal in many countries, with this high caseload of refugees. It's always normal to see some tensions, but because the situation of the Lebanese has changed dramatically, since 10 years ago, we can understand that the level of acceptance is not anymore the same. And the only way actually to address it is, one, to make sure to address the aid bias perception, because for them, and it's true, until recently, they could see that refugees were getting, the support. And frankly, I can tell you, if we are talking about 25% of the Lebanese who are extremely poor, I can tell you that 85% of the Syrian refugees are extremely poor. So we cannot compare, one has also to be aware of the dire situation of the Syrian refugees. But I understand that, you know, that now that the Lebanese are having almost the same needs, it's very important to address them. We are not yet there. I mean, to be very frank with you, mainly because, first of all, the donor community did not use to provide humanitarian assistance for the Lebanese. It used to do it through the Syria crisis response, you know, which is not always a direct, you know, assistance. And today, the Lebanese, even those in the host communities, they need direct assistance. Second, it used to cover only the districts or the villages where there are Syrian refugees. While today, you know, the humanitarian needs are across the country, unfortunately. So it's not only when they are, where there are refugees, but it's really across the country. 1 million extremely poor. I mean, can you imagine? 1 million extremely poor Lebanese across the country. So, so I have to say, it took time, you know, to really convince and advocate with the donors to start also supporting the needs of the Lebanese. And I really would like to make another plea here that the best way for us to protect actually the Syrian refugees is really by addressing the aid bias and making sure that the Lebanese are not feeling that they are not treated fairly, you know, where because they are Syrian, they are getting the assistance, but if you are Lebanese, you are sanctioned because your government is perceived as corrupted. I think it's unfair, you know, so we really need to address it. And that's why I told you about the sector plan we are finalizing and the needs assessment we are finalizing. The migrants, we are below average. I mean, really, again, it was after the explosion that really this phenomena was revealed. Unfortunately, the middle class, as you know, in Lebanon is also very much collapsing. And it was the middle class who had, you know, domestic workers. And with the economic situation, unfortunately, they just throw them in the streets. So we ended up with almost 400,000 domestic workers with nothing, really with nothing. So we started organizing the assistance mainly to help them go back to their countries, of course, but it takes time. And again, we are also missing, and we have a huge funding gap. My last point, I mean, if ever someone is going to ask it, but let me preempt it, because I get this question here. Well, if the situation is what it is, why the Syrian refugees are not going back home? You know, there are very clear principles for us, and I hope that everybody will support it, which is a big challenge for me because I have really to work very hard and most of the time against, you know, some advocacy and instrumentalization from some leaders, is that we cannot pretend that all of those who are here are pro-Assad, because that was the rhetoric lately. You know, they all voted pro-Assad, so they should not stay here. Let me provide you with the facts. Only 30,000 people out of the 1 million voted, actually. The others did not even go to vote, okay? So let's please bring it to reality. Maybe those 30,000, they are pro-Assad, I don't know. I mean, it's their freedom to vote. I'm not going to question it. Second, you know, there are three things that those refugees, when we talk to them, they ask for. First of all, they say, if we go back, we would like to make sure that our kids are going to school. You know, when you have been through such tragedy, you want to at least ensure a better future for your kids. Without school, you don't have a better future, obviously. Second, we would like to go back to our land, to our house, to our village. I mean, it's not that they should go back to whatever you know, the Syrian authorities would decide, and that is a principle in humanitarian assistance. It's a humanitarian principle. And third, they want safety. I mean, many of them are very scared about retaliation because a lot of them are from the opposition, and we all know that. So my answer is always the same. My position is always the same. And if you ask me the question in 10 months, I will still tell you the same. We have all to adhere and to support the humanitarian principle of volunteering return, safe return, and obviously dignified return.
On the question of, we have a question from George Bailey with the Lebanese Information Center on the pandemic and vaccinations. You know, the vaccination rate in Lebanon is now, I think, at 5.5 or so percent. It's, you know, very low given other countries. So how do you assess, he's asking, the ongoing vaccination efforts? What is the UN role in expanding the immunization campaign? And you've mentioned that there is a decline in the cases. When do you expect the pandemic to subside in Lebanon?
Or when do I expect the pandemic to subside? That is a $1 billion question. I challenge anyone to have the answer in any of the countries, by the way. But UN role is very clear. I mean, since day one, we have provided technical assistance, but also scientific advice, you know, about the kind of vaccines. We have supported the expansion of the ICU bed capacity. We have mobilized funds, you know, for the treatments, for the capacity of the hospitals. We are still paying nurses, you know, we are paying doctors, and all, you know, the treatments and the care of the COVID-19 patients, you know, and that was since 2019. In 2021, for example, we have a gap of $77 million. I mean, if we want really to cover all what is needed for the treatment, but also to make sure that the vaccination is going to reach the objective of the herd immunity, which, as you know, based on the scientists, that's the only way for us really to make sure that the country will get out of that. It is slow vaccination, is true, you know, but that's one of the consequences of the trust deficit. You know, because this is coming from the government, actually, a lot of people, you know, they come up with all the conspiracy theories you can think about. Really, the innovative thinking of the Lebanese is impressive. You know, when you think about all the conspiracy theories they come up with, I wish they used it, you know, for other things which actually would help the country get out of the crisis. So that is one. Second, you know, all the bad publicity around AstraZeneca did absolutely not help. And that was the only available vaccine in the beginning. So despite the fact that the vaccine is available, you know, that's the sad part. That it's really the sad part. AstraZeneca vaccine was available since three months ago, but people, they don't want to take it. They really don't want to take it. And so as United Nations, we are really engaged since a while in a very aggressive campaign, you know, and awareness raising campaign about get vaccinated, because that's the only way the country will go back to normal. And that's the only way for people to go back to their life and for the, you know, the restaurants and the stores to open and all of that. Now that the country has got, you know, a good number of Pfizer vaccines, my guess is that, I mean, that's our thinking. People will get vaccinated more easily. That's for sure. Is it going to really fix all the issues? I don't know. I mean, again, what we are doing is really going to the communities, explaining to them why vaccination is so important. And this is really about protecting their loved ones. And it's really that COVID-19 is a very dangerous virus, and that the only option is really the vaccine. My last point is that there has been a huge number of cases. So our guess is that a good component of the population is already immune, you know, just because they got the COVID. The problem is that it's very difficult for us to have a clear, you know, assessment, because we are not going to ask everybody to take a test, you know, for us to check if they have antibodies or not. But that's the bet.
But the immunity is, I mean, to just clarify, is only short term, because, you know, once you've had COVID, you could get 3 months immunity, and then you could get infected again, or, you know, the problem of the variants. And yes, I mean, if you just look at my WhatsApp and see the conspiracy theories that emerge about the vaccines, you'd know I totally agree. agree with you. Are you expecting, are you in talks, with Washington? President Biden is going to announce, a number of vaccinations that the US will send abroad. Has there been any movement on that? Is Lebanon included in this program?
Well, the US ambassador for Lebanon is in Washington. So we are very much putting our hopes on her. So whoever is participating, if you can please add your support, we will be very grateful.
Okay, so I do want to ask you, as we're closer to wrapping up, what would be your messaging for a set of stakeholders in Lebanon? So basically, what's your message for the international donors and partners? That's one. Second, for the US and the EU policymakers, Lebanese politicians, and most importantly, the Lebanese people.
Okay, let me start with the donor community, US, EU, and others, and the Gulf countries as well, because they have also a very important role to play. My first message will be, don't give up on the Lebanese people. I mean, I know that everybody is a bit fed up, with this lack of responsible behavior from a number of Lebanese politicians, but we should not sanction the people for that. And I am known for always hammering this message. It's so important that we stand with the Lebanese people, with the most vulnerable. And it's so important that they know that not everybody abandoned them. Again, as I told you earlier, there is nothing worse than someone that has nothing to lose. So imagine if if those 2.5 million Lebanese who are poor today just think that they have nothing to lose. Anyone can recruit them. Anyone can take them to their side. And that is something we should really avoid. Second, if we abandon and give up on those people, it means that we are giving up on the future of Lebanon. And therefore, somehow, we are not given a chance. We are just not given a chance to this country really to maybe look forward to a better future. The third thing, please make sure that the elections are going to be held on time. Meaning that any attempts of either canceling or delaying the elections should be opposed very strongly. And we should all together stand very strongly against any delay, postponement, or cancellation of the elections. This is a very important democratic process in the country. This is the last hope for most of the Lebanese, people who lost, any hope in any other thing. So they have to feel that we are there for the democratic process and maybe to give a chance to change. Now, if at the end
and
of
just
the
to
day,
clarify, you mean the elections next year?
2022 elections.
The presidential and parliamentarian elections
and municipal
elections,
all of them. So it's municipal and parliamentary and legislative, and of course the parliament will elect the president. I mean, but it's only those two, the legislative and the municipal, because that's the only way really to come up with a change. But then if the Lebanese decided to vote for the same people, then hola. I mean, then it's very difficult for any, seriously, then it will be very difficult to do anything. I mean, and we respect, of course, the choice of the Lebanese people. The fourth thing, please support a comprehensive and inclusive social protection. And I'm telling the donors that because it's true that was not the case before, and that was not the kind of support the donors used to provide to Lebanon, but really counting on you to get all the means for us to address the emergency needs, but also to work towards a more inclusive, comprehensive social protection in the future. Last but not least, please make sure that impunity will stop in Lebanon, because impunity is the name of the game. I mean, look at the explosion. It has been almost a year, and yet no outcome so far. I mean, and the families of the victim, they are not even able just to turn the page and to mourn their loved ones because they have no answer. I mean, and I can give you hundreds of examples. And it's so critical that we keep, supporting justice and independence, of course, of judiciary system, because that's not the case. I mean, that's really not the case. And keep insisting on accountability, 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 and accountability. And obviously the formation of a new government, which is fully empowered to be able to start yesterday the reforms, because there is no other way for the country to get out of the crisis. To the politician, put the people at the heart, in your heart first. I mean, love your people. To be very simple, love your people. All your people.
Yourself, yeah. I mean,
yeah, really, love your people. Do something about them. And if you love them, you will do something about them. And think about them. Think about their future. Think about a whole generation of Lebanese children who today are 8, 10 years old. All what they see is, destruction of the port, social unrest, asking for things they used to have a year ago, and today their parents telling them, well, Habibi, this is too expensive now, I cannot afford it. Seeing their cousins and their uncles and aunts leaving the country because they don't believe in a future. We don't want the Lebanese children to grow with that. We want them to grow with the potential of this country, with the beauty of this country, with what really characterizes this country, a country of potential, a country of the possible, and a country of the people. So that's my message to them.
I just wanted to quick follow up. You mentioned sanctions very quickly. Do you think sanctions, whether those on Syria or those targeting Lebanon, hamper at all your humanitarian efforts?
Well, I cannot talk about Syria. I mean, that's not my.
Right, but I mean, when we talk about the Caesar law and.
Yeah.
It does impact Lebanon. So in your day-to-day coordinations, is that, do these laws, are they problematic?
Well, they have sanctions by nature. They have limits and constraints. What we have done so far is that we dealt with it. I mean, I cannot say that it was something that really prevented us from really providing the assistance the way we need it. We have, I mean, the issues and the problems are more at the access level, which has nothing to have with the sanctions. I mean, but for some very specific equipment, for example, yes, we needed to have some waivers. For some very specific, product, we needed to have some waivers. But so far, frankly, I cannot say. I mean, Syria is a different story. But for Lebanon, at least, we are very lucky. I mean, we have really a great ambassador here and a great head of USAID and PRM. And we speak very frankly. We don't agree all the time, but we have at least a very frank, and we engage really frequently. So we are able to make our points and to get things fixed.
No, that's very assuring, and I guess that's one hopeful note to end on. Thank you so much, Dr. Rochdi, for this very passionate and honest discussion about the situation in Lebanon. I hope next time we meet, whether in person or over Zoom, we would have better news to report on the situation. With that, I wish you a great afternoon, and thanks MEI, thanks to our audience that engaged in this, and have a great day.
Thank you very much, MEI. Thank you, Joyce, for a wonderful moderation. Really. Chapeau. I mean, I wished in all the Zoom meetings I had someone like you. And please, I would like